بسم الله الرحمن الرحيم. أبناء الطلاب وزملائي أطباء الدراسات العليا، يسعدني أن أقدم لكم هذه الأفلام التعليمية التي تتناول الجانب العملي لمادة التشريح. فنشاهد الآن هذا الشريط على أمل أن يحقق الفائدة المرجوة منه مع تمنياتي لكم بالتوفيق. يقول الله تعالى: وقل اعملوا فسيرى الله عملكم ورسوله والمؤمنون. صدق الله العظيم.
In this film we are going to describe the skull. The skull or cranium is divided into two parts: the calvaria or skull cap and the facial skeleton. For the convenience of description, the skull is described from various aspects: from the superior aspect or Norma verticalis, the anterior aspect or Norma frontalis, the lateral aspect or Norma lateralis, the posterior aspect or Norma occipitalis, and from the base or Norma basalis. The skull in general is composed of large number of bones that articulate together at the sutures. Now we are going to describe the superior aspect of the skull or Norma verticalis. This superior aspect shows the frontal bone anteriorly, the occipital bone posteriorly, and the two parietal bones in between. The frontal bone articulates with the two parietal bones and the coronal suture, which extends from side to side. The occipital bone articulates with the two parietal bones at the lambdoid suture. The two parietal bones articulate with each other in the median plane at the sagittal suture. The sagittal suture meets the coronal suture at a point called bregma. And meets the lambdoid suture at a point called lambda. On each side of the posterior part of the sagittal suture, there is the parietal foramen, which is an emissary foramen. An emissary foramen transmits an emissary vein, which is a vein connecting the dural sinuses inside the cranial cavity with the veins outside the skull. In the infant, the bregma is a soft membranous area called the anterior fontanelle, which closes by ossification of the neighboring bones by about the 18th month after birth. Similarly, the lambda is membranous before birth and is called the posterior fontanelle, which closes by about the 3rd month after birth. The anterior fontanelle is of clinical importance as it is used to determine the exact position of the fetal head during labor and to assess the degree of bone development. In case of rickets, the anterior fontanelle shows delayed closure.